Hi, everybody. Welcome back to Let's Be Real. I am Tara.
And I'm Sherry.
And we are two LCSWs in the state of Florida just trying to figure it out. How do we provide services? How do we be the best therapists for you guys? How do we connect with other therapists that feel the same way? Because this community is not so small.
Absolutely.
So today, I think our focus is going to get a little bit more to the core of what Sherry and I tend to cuss about and bitch about in our happy hours that inspired this podcast to begin with. So Sherry, what's the platform today?
Well, we've been talking about the idea of, you don't need to have major mental illness to come to therapy. But we've missed. So now I want to go back to the side of what happens when we do have major mental illness. Where do we go? Where do we send our kids? Where do we help our young adults? Where do we help our parents who, that have had these mental illnesses that have never dealt with them? These are real life things that happen every day, and people will call me and say, oh, I know you do this. Where would I send this person? And a lot of times I'm embarrassed to say, I don't know of any good place to refer you.
Yeah. What a sad story to paint, right?
It is. And I would like to say that, I don't know if I'd like that, but I wish it was just the state of Florida that was a problem. And I don't have any stats on this because that's not why you came to us, right? But we are one of the lowest, we're number 48, I believe, something like that, in how we pay for mental health in the state of Florida.
Okay.
Compared to the rest of the country. And I might have made that number up, but it's pretty close, in my understanding, that we have a lot of rules and a lot of ideas and a lot of funding streams that really don't do anything.
Okay.
And when I say that is, we have a system of Medicaid in the state of Florida that is run by managed care. So that's a big problem.
What does that mean?
That means, right, so that I don't have Medicaid making my rules about how I can get my services, how I can go to an inpatient or outpatient, or who's going to take me. Now I have another provider, such as Humana, Sunshine, all these other different insurance companies that have come in and said, oh, I'll manage this for you. Well, now they have to take a piece of that, right? So they're not going to provide every service that Medicaid might provide.
Gotcha.
Right? Okay. So there's a lot of, do I really need to know this, Sherry, kind of stuff. But at the same time, it's a huge hindrance on the services that we need when we desperately need, right?
Well, these affect the systems that provide care, even at the foundational level, even for people who aren't in major mental health crisis.
Right.
Right. So even those that I like to appeal to that just have stressors and want to be able to process through those stressors and learn life skills and mental skills to move through that for the rest of their life. So these systems influence how anybody gets care, right? Because it sets
Absolutely.
a standard for how we get paid, how other people pay for their services, how insurance companies are going to set up their payment and their fees and their billing codes and all those things. It all influences each other.
Right. Right. And so what you're saying, absolutely, like that goes back to the idea that if I want to see what we called in grad school the worried well, your average life transition issues. And we've talked about this before, that I have to give a diagnosis if I'm using insurance. But if that person's not using insurance, I don't need to do that because there's probably not one, right? So in order to get treatment, you have to be pathologized. What about when you really need it for a true pathology? Right? Mm-hmm. Somebody who can't maintain themselves at home, somebody who can't, their parents are 75 years old and their child is 35 or 40, and they've spent their whole life trying to figure out what to do with this person that they don't know how to handle.
Yeah.
They don't know, and the system doesn't know how to handle it either, right? So we went from the prior to the 80s, where everybody, we just sent them to an insane asylum, or we sent them to some kind of system that kept them forever.
I get that question sometimes more from like social circles rather than professional circles, of asking what happened to mental hospitals, what happened to asylums. And if you want to do a deep dive, I could open my laptop here and do it, but also not that kind of podcast. It is not a pretty picture.
No.
It wasn't managed. It wasn't managed well. It wasn't care. It wasn't humanistic.
Right.
It wasn't humane. It was,
it was ugly. It was just like what the shows show you, right? Probably worse, and sometimes maybe not as bad, I hope. But again, we live in a world of living in a pendulum, right? We don't know how to go from one extreme to the next. Nothing's in the middle.
Yeah.
So you go from a system that medicated you to sleep all day and not be able to talk, or, put you in a coloring room and that's it, right?
Exactly.
Or a padded room, to now, if you're lucky, you're going to get 72 hours. I'm really not going to do anything for you anyway, and then we're going to send you on your way.
Right. I mean, working in the schools, we talked about Baker acting a lot. I think that conversation didn't always serve the purpose of the conversation, right? Because we're talking about kids. We're talking about minors that need urgent care. So Baker Acts, which are involuntary holds for when you're threatening harm to yourself or to others, is a Band-Aid approach. It is immediate safety and supervision. It rarely has anything to do with tools or skill building or coping skills. I've heard of groups. I've heard of like time with a psychiatrist, time with a therapist, a case manager. Maybe they walk out with a prescription. Usually they walk out with a prescription, but they don't understand what that prescription is supposed to do.
Right. Well, let's say they were on meds before they went in there. Well, they got a prescription that completely changed what they were taking before, because obviously that wasn't working. And we're talking from, I'm saying this from real life experience as a parent, and then also experience as provider on the outside, providers on the inside, seeing that the psychiatrist, and this is part of fee-for-service problems, seeing that child or adult for no lie 5 minutes.
That's generous.
Right. That I'm being very generous in the 5 minutes, right? So, hey, how you doing? You're feeling okay? Oh yeah. Oh, he's depressed and has anxiety. Let's give him this. Let's give him blah. Saw him for 5 seconds, right?
Yep.
And then you have a social worker that works there that may see the family, that may have a family visit. You're not allowed to talk to anybody as a parent while they're in there, which sometimes is good and sometimes is bad.
Right.
Okay, get it. And then, here's your child back. Sorry, we made an appointment for them. We hope you make it. We hope it's a great provider. We don't know. See ya.
Or, we're going to release you in Boca Raton, Florida, but that provider lives in West Palm Beach, Florida. Hope you have reliable transportation.
Right. I mean, I've had people that were my clients as part of a court system, as a mandated client, right? They ended up getting Baker Acted somewhere. That system sent them, we tried. We couldn't find a provider for them or a housing situation for them. So you know what we ended up doing? We gave them a bus pass.
Yep.
And we sent them to another county.
Yep.
Oh, well, that's nice.
That's nice.
So I don't, and my hope for this podcast is not just me sitting here and complaining the same conversations that pretty much all of us as providers in the state of Florida, or really, I imagine any state in the United States, has the same concern, right? But what are we going to do about it? So that's where I really would like people to start listening to, it may not be your problem right now. It may not be a problem you thought you ever going to have to deal with, because you don't have major mental illness. But I guarantee you that somebody in your life, at some point, you're going to be touched by that. You're going to have somebody in your life, a child, a stepchild, a family member out of the woodwork, or somebody's going to be asking you, what in the hell do I do with this?
Yeah.
And that's what happens. It's what the hell are we doing? Because it's just not working.
Right. And I'm going to get back to the systems interlocking with other systems too. We are all touched by this in some way, shape, or form. It's about our economy too. So if we're looking at, I only have the state of Florida to reference, but I've heard statistics that are horrific in states like California or other transient states of the homeless population.
Oh, right. They all send a bus because who wants to live? What person wants to be homeless in a cold state? Right. So we're good. That's how we clean our streets. Give them a bus pass to Florida. And it happens. It happens all the time, right? Because if you're going to be homeless, why not do it in the sun?
Well, that happens with patient brokering and addiction treatment facilities too.
Absolutely.
It's literally feeding numbers to make us look good. And by us, I mean those facilities, so that they can say they have a 90+% success rate of getting people clean and sober, which if a facility is telling you that they have a 90+% success rate in sobriety, it's bullshit. Oh my God.
Totally. It's total bullshit. And we live, not to cut you off, sorry, but that's what I do. So this is the state for that.
It is.
Right?
It is.
This is that, I think Florida and Las Vegas.
Really? For addiction?
Oh, yeah.
I know about Malibu, right? So
oh, well, for sure, right? You know, those are the places that come to us.
For $15,000 a day, you too
can live like the stars, which you probably were anyway if you spent $15,000 a day anywhere.
Oh, you could pet some horses and look at the beach.
Right, but let me ask you this. If you're schizophrenic or have major bipolar with psychotic features and you just tried to run your neighbor over, do you think that they are going to go eventually, even after go to jail or anything else, do you think they're going to send you to a nice $15,000 a day place? No. What's going to happen? You're going to padded walls that, yes, they do still exist.
Yes, they do.
Or you're going to go in a room, and let me tell you what happens when you have a teenager that goes to a place, or a young child. Any of them, any of these places, any age. But to me, it's the worst for that, right? Please bring in clothes for them. They cannot have any drawstrings. They cannot have any shoelaces. They cannot have anything that could possibly hang themselves with.
I don't even think you can have belt loops.
You can't have a belt loop. You can't have a belt. You can't have, they're going to give you some, and if you're in jail and you're on suicide watch, you are wearing a turtle suit.
Yeah.
And these are our ways of figuring out how to stop people from killing themselves.
Right. Is just to pause them from being able to have any agency or movement or, no thinking for themselves.
Right.
Because they can't be trusted to think for themselves, which is ridiculous.
Exactly.
Have a human moment.
Have a human moment. I could be strung out, and I apologize. I'm not trying to make up, bash the substance abuse community. I'm bashing the system itself in how the disparage between the two of them, right?
Yeah, right. These are real things that happen. These psychotic features do show up with addiction and with the overuse, misuse of substances.
Right, but you know what? Because I have that substance abuse, we're not going to deal with your mental health.
No, there's no comorbidity.
Because there's more money in this side. Why? Who decided the money goes to substance abuse and not mental health?
Yeah, because peeing in the cup is now worth a lot of money.
Oh my
Hi,
gosh.
halfway house owners.
Right. And let me tell you, and you put yourself in a court-ordered situation, and you know what? We're going to put you on random drug tests, and your ass is going to get tested 2 to 3 times a week. Who's paying for that? Okay, so that's a whole nother conversation. But
I have it on my list.
Right. It's always on my mind because I've been in all of these different situations.
Yeah.
And I honestly feel like I've been put in these situations on purpose so that I can have this discussion with you. Not my personal, but like personal, professional, all kinds of things, right?
Yeah.
That somehow these things have found their way into my life for a reason to be able to share it with all of you. This was predestined. No, just kidding.
We don't have to hold on to these stories anymore.
I can throw them up to you instead. No, but the idea is, what are we going to do? Reagan in the 80s said, no more, let our people out, just be done. Well, thank you, but no thank you. So what do I do now?
Right. This is the pendulum swing.
Right.
What we're doing isn't working, so we're going to shatter the whole thing. And
exactly.
see what happens. Here we are. This is what happens. We still have sick people. We still have people who need help. And the only help they're getting is either in 72-hour hold or prison, which is the number one mental health provider in the state. And that
I'm sure, and that's probably in the country.
Probably. But that should say a lot, right? If we're going to criminalize mental illness, why would you seek help?
But let me ask you this. How many people have you seen in this situation that's the only way they get any help? They got arrested, right? And I get that the idea is you got to hit your bottom. But if I've been threatening my mom or I've been talking to this voice in my mind that tells me I need to hurt somebody and I need some help before I do that. Yep. Oh no, sorry. You're not actively psychotic.
Well, what? That speaks to our criminal system too, where something bad has to happen.
Right.
Something really bad has to happen.
Right. So now in the state of Florida, I can only speak for the state of Florida, but the Baker Act, which is the voluntary hold or involuntary hold, right? That no one could transport them, right? Except for the police department, right?
Correct.
And listen, I get it. I don't want to be driving the paddy wagon around myself either and start collecting, which, forgive me, I know that sounded terrible, but you'll get used to it. I'm offensive. I know. So, but the idea is I don't want to be driving around. I mean, most people, most social workers would be scared of going to do that, right?
Even though personal vehicles, like what resources?
But you know what? We do it every day. We deal with them every day, and we deal with this every day. And if I could get my client, if I was allowed to put my client in my car, trust me, I would get them there, right? I'm not saying I don't want to do it. I'm saying most people are afraid, but then there's insurance logistics. There's there's liability that we've with everything else, we've gone to the complete extreme, right? So we have to find some middle ground. We have to stop making paper more important than the person. Yep. We have to stop making. Listen, we all want to make money, so I'm not saying we don't want to make money important, because that's the world goes around. I'm going to be honest. Okay, I agree with that. You have a system you want to make some money for in it. I get it. But let's be responsible in how we're doing it.
Yeah. Right?
Let's be responsible in how we're caring for those people. They are not just numbers. They are not just money. No. And a lot of these places, maybe the people started out in the beginning with a great altruistic plan in their mind. Oh, yeah? And when they realized,
who are they?
Yeah, right? Okay, so I'm hoping that maybe 2 or 3 of them, right? But 2 or 3 in the whole grand scheme, right?
That's
but
fair.
Then when it comes down to, how will we get paid for this? How do we get paid for this? Am I going to bring them into my house and care for them?
Right.
I got to have a facility. I have to have people. I have to follow ACA. I have to follow all these other dumbass rules, and I got to have staff that aren't assholes and aren't here to kill them. Right? They're not, but I can't pay them a lot. So what am I going to get?
Yeah.
Right? So again, the system is broken. Somehow substance abuse side has seen that it's possible to care for somebody with these issues in a humane, clean, respectful way.
But they're still not dealing with comorbidity. They're still not dealing with multiple diagnoses.
Yes, you're right. And that's the main problem, because it's still there. It's still existing. They're dealing with only the substance abuse side. But it's not that person is not actively psychotic.
Right.
Or that the person is not actively hearing voices and saying, I'm doing everything in my power to keep that under control. That is extremely hard.
Yeah.
And I have the utmost sympathy and empathy for people who go through that.
Yes.
Nowhere in my life would I want to trade for that, but the answer isn't just let's have more meds for it. Let's just have more of this for that. Like, the answer is we have to have a whole life system to care for these people.
Right.
This is a life situation. This is not I have some anxiety and take some meds and, have a good therapist and move on.
Right.
This is not that way.
Put them right back in the environment that triggers them, that makes them sick, that makes them not feel like they're able to practice.
Right. And I will allow this time for you to continue with that word trigger because that was appropriate.
Thank you.
That was appropriate.
I'm very mindful of that.
Oh, good. So you got 2 words in one.
Who was paying attention last episode?
Me.
So it's broken system. There is plenty of money.
Okay, so let's talk about that.
There's so much money.
So the solution, from what I hear, right? The solution is we think that the devil is the person who wants to make money, the for-profit, right? We think of that as the devil. Okay, I get it. But we've somehow decided that not-for-profit is going to be any better, right? So we're going to give them to a not-for-profit, and then hope that they are going to manage that money any differently. I'm not saying that one is better than the other. What I'm saying is that if you have a for-profit who has a great idea and all you're missing is major capital to do this, and there's money, why are you going to give it to the other? Because it's a mandate that the substance abuse, mental health, how do you say that? Is it SAMHSA? Okay, so that's a federal system, right? They can't give you any money if you're a for-profit. Okay. So I'm not saying we want to make billions of dollars, but what I'm saying is that you can't limit who is going to be the entity who is going to make the best decision and best care. Because otherwise you deal with Medicaid standards. Have you ever, as I'm saying this to people who are listening, have you ever tried to get anybody into either assisted living facility, a nursing home facility, any kind of facility where Medicaid might be involved? They have 1 bed. 3, 2, 1, right?
One available, and they'll let you know how many applications they're planning on getting for that bed.
Right. So we have one available. So we got a really long waiting list. That's the same thing for low income housing. That's the same for excuse me. So I work in a town that I'm not going to say out loud, but part of the time where the number 1 employer is the Social Security Department, Social Security Administration, right? Because we've decided that because we can't function, and I don't mean just major mental health, right? All kinds of reasons. We can't function. So it's okay that I'm going to live off of $780 a month. I don't know about you, but nothing else is going to really happen there. So I would love to have a place or a group or whatever to say, hey, I'm so sorry, because they're going to deny you 3 more times. So I want you to understand that you're not disabled. Social Security already told you that 3 times.
Yeah.
People in wheelchairs can work. I'm not saying that people shouldn't have disability, but all of this goes hand in hand with the other part, right? You're going to have somebody who's now on disability for mental health reasons, right? For schizophrenia, bipolar. Okay, yes, they should absolutely, but let's fund it in a way that they can actually function.
Yeah, the productivity and agency of life. But Social Security and any kind of welfare program is not designed to encourage you to get out of it. It's not.
Absolutely.
It's designed to suppress you and keep you dependent, because the less dependent, or the more dependent you are and the less in control you are of those decisions, the better the system has a grip on you.
Absolutely. Let's mark that as a clip, because absolutely, because that is so true. Yeah. That is so absolutely true.
It's oppressive.
It is. The whole system is oppressive, because why? They don't have anything to provide to you. And that's the thought process. You're majorly, okay, so somebody who, I'm going back to my court days, right? Of somebody who's been through the system, I'm going to tell you at least 30 times that they've been arrested for trespassing, other, very low level crimes.
Sure.
Trespassing is about as low as you're going to get, right?
Loitering,
right? Something like that, right? And then when I say trespassing, you're just bothering the people at the gas station, and you're like, hey, man, give me some money. I want some beer, right? But again, some portion of that are your schizophrenic population who grandma is trying to care for. They keep leaving the house. Grandma's done. Okay, so now where does this person get housed?
Yep.
Okay, so we may have a couple assisted livings that are going to kick in there, maybe if you're lucky.
Oh, like group homes.
Right? When they call those assisted livings also. But those programs are not set up either because there's not enough staff. It's one guy running it, and God bless him, he's doing the best he can, right? But now we're going to say Joe has decided that he's going to wander around and smoke pot all day long.
Yep.
Okay. Well, all right. So now Joe's got to get kicked out.
Yep.
Joe's not taking his meds. Joe's living on the street. Where's Joe going back to? He's going back to that same gas station that he's been arrested at 5, 10, 20 times. It keeps going around in a circle. So is the answer for him to be sitting in jail?
Right.
Because that's what happens. Yeah. Joe, I'm using this as a real life person. Joe is sitting in jail and has been for a year. He's been sent to the state hospital, which, let me tell you, it's very hard to get into the state hospital. Everybody just says, oh, we have a state hospital. Why don't we use it? That goes back to our discussion, right? The state hospital does exist, but you have to commit a felony in order for me to make you go there, right?
Okay.
So trespassing is not a felony. It's
Correct.
A misdemeanor. So if I continue to do this over and over again, where are you going? You're going back to jail. You're coming back home. You're going back to jail. Somebody's going to say, whoa, but okay, we'll just leave him in jail. That's what ends up happening.
Yeah.
And small town jails, even some of the big town jails in Florida, we don't have any mental health in the jail. And if you're lucky, you're going to have a program that will come and take care of that, right? But you got to be in the community. Now, okay, so now you're in the community. Where are you going to live?
Yep.
Grandma's not taking you back. Grandma's scared. Or grandma is just tired.
Yeah, she's done.
She's tired.
Yeah, her trust is spent.
Right. But you know what? Joe's not a bad guy. Joe has got, he's no one's found the right meds for Joe.
Yep.
No one's took any more time other than a 5-minute. My public defender saw him, and every therapist is going to come and say, ooh, what am I going to do there?
Yeah.
Right? So it has to be a full coverage of services. Like we have this system called wraparound service, right? Which is a wonderful idea. It doesn't work. Sorry. I mean, it's the concept is amazing, right? And when you sit down at a state office or a state board meeting or some kind of function where you're discussing this, oh, you know what? That sounds great. We're going to make everyone go into your home and give you services. And that's the only way you're going to get services. I have to come to your house.
Yeah.
Okay. I have to come to your house. Do you want me in your house? No. Okay. So we're going to come to your house. We're going to make that the standard of care.
Right.
And then we're going to make it that everybody that's involved in this person has to talk.
Yep.
That sounds fabulous, right? But it doesn't happen.
It doesn't get executed that way.
It does not get executed. So why not have people be able to live in some type of communal situation? Right? We have an assisted living kind of thing where someone comes and makes sure people have meds. Everybody comes to them. If you're going to have to come to them anyway, why not everybody work there?
Oh, a cooperative.
A cooperative, right? We work there. We take care of each other. They're part of taking care of where they live. Not, you know what? You're going to have disability. I get it, right? But not, I got my own place on the $780. I don't want anybody to come in my house because, you know what? I'm scared of people.
Yeah.
Right? The government's after me. And I'm not making fun. I'm saying these are real thoughts that happen. Yeah. Right? The government's after me. You're here I'm paranoid. You're the last ones coming in to do anything to help me. Right? So it needs to be this real wraparound, not 20 agencies involved with one person.
Right, because does that patient, does that client, does that person, that human feel the help with people cycling in and out? If you were to take any kind of score or evaluation of your program, which I've noticed not many of them have done, would that person say that they felt sufficiently helped based on the team that they're working with? And I would bet some money, and I am not a betting woman, that they would not feel helped. They would feel maybe let on, maybe enticed, or maybe they have like one or two people that they connect with, like their case manager, maybe a therapist. But other than that, they're not finding the sequence of meds that work for them. They're not finding the housing situation, the vouchers, the programs that are going to connect them to where they're trying to get to.
Right, because I have to get somewhere else. I have to find transportation. Okay, I have $780. Okay,
Yeah.
Maybe there's been an increase. Okay, so I'm going to give you $800. Okay, so I have $800 to now pay for where I live, to get some kind of transportation.
Yep.
Yeah, I have Medicaid and I have Medicare maybe. And they have their own transportation system for medical and sometimes shopping. But when you have an appointment scheduled to go somewhere and that person does not show up,
Right.
it happens all the time, right? So it sounds fabulous. We're going to give a little money to you, and we're going to give a little money to you, and we're going to give a little money to you, and we're all going to come and take a little piece of this person,
Yeah.
right? And that's how we manage care. No, it needs to be a full wraparound where they live, bring it to them. If you're going to want to bring it to them anyway, then it needs to be part of their living situation.
Yeah. And I think there has been attempts to do this. Like Florida has a lot of leniency when it comes to halfways or sober living.
Yeah.
It doesn't take much to qualify your extra
Absolutely.
bedroom in your home.
Until your neighbors want to kick you out.
But they would have to legally do that.
Right.
That would be a huge system. And you're still collecting money while you're running your little sobriety guest bedroom.
You just brought up some all kinds of, like, oh, forgive me, I have such trauma from that system.
Likewise, I was a pawn in that when I was not even a therapist. I don't think I was even in my grad program yet when I saw what was so glaringly wrong. Because I'm a human that wants to help humans, and that's not a system that wants to help humans. It's a money-making scheme, and it's in and out patient brokering, which I said earlier. Stay tuned. I would love to define that in our addiction treatment episode.
Well, I mean, that's part of this, right? I mean, tell us what that is.
Oh, yeah, you're right, because
it's part of the whole system. That's how we get people, right?
So patient brokering is when you basically go out and find patients, clients that would work for your system. Maybe they've been through your system already, whether that's a facility, whether it's a program, and you give them some incentive to come back and boost your numbers. Now, when I say give them something, I'm talking about giving addicts who are clean and sober drugs and alcohol to come back into their program. Talking about financial incentives. It's disgusting. And I was working for an agency at the time that shall not be named. It will not be hard to find. I was reading a BuzzFeed article at work at this place, and they had a picture of our intake, the door of our intake. I was like, this is a really unique font. That's our font. Are they talking about us?
Uh-oh.
Oh, they sure were. I was in my office employed by these people while I'm reading a BuzzFeed article about how they are paying former clients with drugs and alcohol to bring them back because they had successfully passed and graduated the program, and they needed their insurance and their billing to help facilitate their funding.
Successfully, that's why they're coming back, right? It's successful, right? Okay.
That's another facility that was boasting a 82% success rate.
Okay, that's more realistic. Probably not.
No, you need to be under 50% if you're being realistic.
Sure.
I'm sorry.
If we're a more than 5-minute program. So I totally, like, the whole system and it is a mess. And the problem that I find with the idea of changing it, it's not a money problem.
It's not.
It's not so an example of the not having a regulated system for halfway houses and sober livings. Okay, so that sounds fabulous, right? I don't have to follow any rules of the state. I can do what I want. I can care for my clients the way I want to and should, right?
Should.
Okay. So, but then I find out I can cram as many people as I want.
And I get paid for their little cups of pee every time I ask for it.
Right. But you know what? I had a place that should not be named, but should be at the same time, should be shamed. Shamed, shame on you. In Fort Pierce, Florida. Leave it at that. Okay. The gentleman who owns the place has multiple homes around a main center of service, right? They all have to come to this main place for chapel, okay? So, but they live in all these little houses that have he, meaning not really him, but them,
Okay.
redo these houses,
Okay.
right? So you have an old house in a very scary, drug-riddled neighborhood,
Okay.
okay? Some of those are 4 or 5 bedroom houses,
Okay.
attic rooms, sometimes 4 or 5 people per room,
Yep.
$500 per person,
Yep.
and they're revamping these houses. They are the ones having to fix and in the name of volunteer work.
So they're flipping homes.
They're flipping homes because, yes, once those are finished, those homes are sold.
Isn't it amazing how we can use our own populations to gentrify the very neighborhoods that we're seeking to support?
Oh, and let me tell you, that's not happening.
Fucking A.
Right. So we're manipulating the entire neighborhood because now the neighborhood across the street, they're all buying from, because right next to, they just get their drugs from across the fence in the house they're living in, right? But you know what? If you're not testing positive, we're going to kick your ass out for 3 days. 3 days. We have to make you leave for 3 days. Where are you going to go for 3 days? I just paid my rent.
You're saying if they're testing positive?
Yeah, we have to kick you out for 3 days. That's what most sober livings do. Most halfway houses. They have a rule. You get drunk here. You're on drugs here. That's not allowed. I'm going to kick you out, but you can come back in 3 days. Why?
It's like a suspension from school.
Right. But now I got suspended from my home.
Right.
Where am I going to live for 3 days?
No, what does that teach me? What
nothing.
skills do I get? Same thing
with suspension, right?
That's where my head is going. Yeah, suspension doesn't treat anything.
Right. I haven't given you any better service. Right. I may not even actually, if we're talking sober living or halfway, I may not actually provide you any kind of sober substance abuse program. This one I'm speaking of does somewhat, right?
Right, but to be licensed as a sober living facility, but you don't have to provide programming.
Didn't we just say that we don't have to be licensed? Didn't we just say there's no regulation?
The leniency to get licensed, I think it's just an application.
I don't think there's actually somebody please tell us that. Because I may be talking out of my ass, and I know that some of this might be changing. But honestly, if I'm a company and I want to start a sober living in my home, maybe I have to start a business, or I have to have some kind of
maybe that's what it is. You're just applying for an LLC through Sunbiz or something like that.
Maybe, but there's people that I've known in neighborhoods that I've lived in before where people will say, oh, you know what? I'm afraid to sell my house to this person because I just found out that they're going to be a sober living, but nobody else in the neighborhood knows this. And they're like, well, I guess that'll end up being their problem. I'm not saying that the sober living is a problem to the neighborhood, because those people are working hard to stay there. Most of them, right? They want to stay under the radar.
It's a system that's designed to work. It's just not working in practice. We have so many great theories that you and I are talking about today. So many great theories that if we were humans treating humans, it would be phenomenal. But no, it's trickle down. The message is lost. It's a big old game of telephone, and I don't even want to blame greed, because it's more than greed. If there's enough,
it's more than that, right?
If there's enough money going around, it's not greed, but there's definitely the humanistic aspect of power and that not being treated very well.
So the answer is not, for me, the answer is not more regulation, because then that just makes things worse, right?
That's a system. Then it becomes a system problem.
It's a system. It already is a system problem, because they try to get, not just for that, they try to get their hands in everything. And so now, again, I'm going to just leave it at this. More paperwork. Any piece of paper is not going to help your client.
Right.
Right? If I'm schizophrenic, I'm not going to sign answer any surveys, because I'm afraid of your survey, first of all. Mm-hmm. Second of all, it's part of the disease. Yeah. It's part of the disorder that I'm not going to answer those.
Yep.
I'm not going to provide you, this lifelong problem.
Yeah. More paper, more problems.
More paper, more problems. Yes. Okay.
So looking forward to our next conversation, just to tease everybody a little bit, is we want to get a little bit more conversation about solutions and what those actually look like. We had hinted about what this kind of care looks like for children. And there's a whole aspect of that we can cover that will likely be touched on, if not covered, mostly in our next conversation. So please look forward to that, because we do have a guest that will be joining us, our first guest on the show. Yay. So it won't just be our opinions and just throwing out ideas and bitching and moaning, as I keep repeating myself.
Right. We have somebody coming that has ideas and has plans, and we want to make sure that you that's why we're talking about this today. We want to make sure when you come back and listen to us again, that you know that there's solutions.
Yes.
Help us make those happen.
And we're inviting those conversations, so please have them with us. But until then, this has been Let's Be Real with Sherry and Tara. Find us, email us, Let's Be Real with Sherry and Tara @gmail.com. All of our socials at Let's Be Real, Sherry and Tara. Bye.